The call-in phone number never changes here on the long-running High-Tech Texan Show. And, of course, it's 713-212-5950. I see you. I see a few people on the line. Stand by, simmer down, because I want to talk to you, but also I want to bring in experts. And I thought of a friend of mine, Dr. Fred Aguilar. He's been on my show several times. He is the premier Houston body doctor. By the way, it's HoustonBodyDoctor.com. You know, facelifts and eye lifts and many, many other things. And I'm standing in line at a restaurant behind this lady. I don't know her name to this day. I didn't say anything, and I'm just thinking, I'm like, something's wrong over here. And with that, I'll tell you what I do. I got to get him on the line. Joined right now by the Houston Body Doctor himself. His name is Dr. Fred Aguilar. Doctor, how are you today?
I'm fine, Michael. Thank you for having me on. I'm so excited to be on your show again. Thank you.
Well, I'm sure I pulled you. You probably have a scalpel in one hand, and you're sutured up, ready to go. So I'm not going to keep you long.
No, we're good. We're good.
You know, we talk all the time about how to choose a proper surgeon in many different areas. And in Houston, which is, I don't know, is that the plastic surgery capital of the world? I mean, you can extrapolate on that for another 2 hours. But let me finish the story. You just heard me start talking. I was in line at lunch, and I see this lady, and she's with somebody, and it's just my eyes gravitated towards her because her face was, I'm going to say it was disformed, but it was without a doubt she had plastic surgery, and her lips were as big as my butt. That's number one. And, you know, she was trying to dress young, and I get it. We're all trying to beat the clock, but at some point, I think people go overboard. People go too far, and you know, this is the industry that you're in. At some point, when people are choosing a doctor and they're deciding how far to go or how much to do, let me put it that way. I mean, where is you as a professional? Do you say, let's just kind of put our toe in the water? Let's not do the entire overhaul at this point. Where is the point that you direct patients?
Look, I think that the important part is that besides the fact that anybody, and literally in this day and time, anybody can stick a needle into you and inject filler and Botox. There are no state regulations right now on who can do this kind of work. So unfortunately, a lot of people go to less qualified people because the price is right. It's probably a short drive for them to the local shopping mall or, if you will, spa that's around the corner. And they end up getting someone that's not medically trained. But more importantly, the act of sticking a needle in and injecting fillers and Botox requires some artistic potential and some artistic eye that will allow the person that's doing it to say, this is where I stop, because this is what looks the most natural on you. And what happens to these people that just say, okay, just put me in, they inject the filler and they want it to just use it all so that they can sell it, number one. And this person ends up looking like a caricature of themselves. And it doesn't look natural, because the people that were doing it are just trying to sell product and move them on through. And that is the big problem. When we're trained as plastic surgeons and we have proper training, along with that comes, or should come, the ability to say artfully, this looks good. Have I told patients no more? Yes, many times. Have I told patients we're only doing a little bit today, we'll do a little bit in a month? Yes, because sometimes putting a whole syringe in at one time is not the right answer. That's where it becomes important that you go to someone with the expertise and the training and the art skills to do this.
I got two things that stuck out in that conversation. I like them a lot. Number one, I like you used the term art and artist in many ways, shape, and form, Doctor. You in your profession, obviously with all your background and your credentials, you are an artist. I mean, the canvas is somebody's face. The canvas is somebody's eyes. The canvas is somebody's lips. And it makes sense. I never looked at it that way because, a lot of people go to art school, graduate. I mean, you've been to more school than any artist that I could probably imagine. And then you also said that it's the sales point, the upsell. I guess a lot of people come in and when they want something done on their bodies, they want an immediate result. And so they're probably going to say, do it all right now. Inject more
Right.
because they want to walk out the next day looking like that. And they're not thinking long term of how, and I'm not going to use the term bad, but how different they look in the ramifications down the road.
Right. You know, and I'm actually taking a couple of semesters of art class to learn to paint and to define a human anatomy or a human face. And if you look at a lip, there's a certain structure to a lip. The upper lip is an M-shaped structure. And in order to put filler in, you want to highlight the M part of the lip, and then you want to gently fill the red part of the lip. And knowing the difference between those two is critical. And being able to combine the two is paramount to a successful fill of the upper lip. Many of the injectors that are out there right now do not understand that concept and will fill the red part of the lip to the exclusion of any of the defining points of the upper lip. And that's why you end up with people that, you know, you've heard the expression, I don't want my lip to look like a duck. I don't want to look like a duck. And it's exactly what has happened. The people that have injected them without understanding the anatomy, the artistic view of a lip, overfill a lip and leave people feeling less than happy with the result and giving plastic surgery, you know, a bad name all the way around. But again, remember, these probably are not board-certified plastic surgeons that are making these mistakes.
Yeah, it's almost embarrassing. As I said, to use the example just a few days ago, I was in line. I'm like, oh my gosh, it's just, look at this face. It's just sticking out. It's just, without a doubt, this person did have a facelift and a lip, you know, filler and whatever. And I guess, let me ask you this. At the end of the day, is the goal, I guess, for you professionally, and I think a lot of people too, to have something done, but make it look like it wasn't done, or at least maybe gradually, instead of, oh, yeah, who is this new person?
That is exactly the right point that I was trying to make. You've hit it right on the head. In other words, it's better to do a little bit at a time, and over a period of 4 weeks, notice the change in your face, because then people just go, wow, you look rested. Did you change your hairstyle? Something's different, but you look better.
You lost
As
weight.
opposed to the very next day, someone saying, oh, my God, what did you do? There's a big difference in that, and you're absolutely right. I've told many people I'm not putting the whole syringe in now, especially under the eyes. You know, doing injections under the eyes is gaining popularity. But there are some fillers that shouldn't be used under the eyes because it globs up. And there are some fillers that even if they don't glob up, you've got to go really slow because they can create bleeding. It can create a lump that is not going to make them happy. So absolutely, small bits over time is much better than putting it all in at the same time.
Dr. Fred Aguilar joining me, HoustonBodyDoctor.com. Doctor, I'll get you out of here on this one. To all the points we've talked about, there's really no way, or correct me if I'm wrong, is there a way to go back? If you just overdone somebody and they're looking at it going, oh my goodness, how do I get my lips smaller? How do I get my eyes back where they were? I mean, I don't think you can go back, can you?
You can't go back all the way to having nothing there. There are some materials that we can use that help dissolve some collagen, help dissolve some of the fillers that we use, but you can't dissolve it all, and you certainly cannot take it out by cutting it out because it'll, of course, deform that body part. So, yeah, you've got to really be careful, and it is not easy to dissolve it.
Look at that. You know what? It's his name. The website is HoustonBodyDoctor.com. And believe it or not, I made it through an entire conversation for the first time, I think, with it, Dr. Fred Aguilar, without talking about boobs. Okay? We're going to do that.
Congratulations. Yeah, we'll do that another time.
Do you know that?
Like
listen, my favorite subject, it's technology, it's bourbon, it's cars, and it's boobs, and it's pretty much in football too. But we're going to go. We'll definitely do something about that, without a doubt.
That sounds wonderful.
It
and
is.
Thank you for having me on. It's such a pleasure, and the educational part is so important for me. And it's a great service that you're doing for your listeners.
Well,
so
yeah, I appreciate it. Yeah, and I do hear from the listeners. They do thank me, and I think I forward them to you. And matter of fact, if you want to throw out your phone number right now for your office, if people do have questions for you.
Sure, it's 713-521-4777. Simple.
And it's HoustonBodyDoctor.com. Call and tell them.
HoustonBodyDoctor.com.
Exactly.
Yep.
Tell them you heard it on the radio and with Michael Garfield, and you get, it's a great consultation, I know. Always good chatting with you online and offline. You're talking to the filler-free face as of right now,
Amen.
Michael Garfield.
Amen.
I'm keeping it real, all natural for me right now.
All right, Michael. Sounds good.
Okay,
Thank you for having me on.
Thank you. All right, that is Dr. Aguilar. We will come back after this. And, Shannon, I know people for some reason over there if you need to get something done. But you're so young. Shannon, what are you, like upper 20s? You don't need it. You're pretty late over there. All my listeners pretty. But if you need help, HoustonBodyDoctor.com. Michael Garfield, the High-Tech Texan Show. Don't go anywhere. We're going to be right back after this.